Acute sinusitis is a common inflammation of the sinuses. In this video, we'll cover the main symptoms, causes, and effective treatment options for managing this condition. Acute sinusitis is a symptomatic inflammation of the paranasal sinuses and nasal cavity. Most cases occur as a complication of a viral upper respiratory tract infection, e.g. a common cold caused by respiratory viruses such as rhinovirus, and symptoms can last up to 4 weeks. Acute sinusitis can also be associated with asthma, allergic rhinitis, smoking, or exposure to smoke. This guidance applies mainly to maxillary sinusitis, as this is the most common clinical condition. Main symptoms of acute sinusitis include 1. Purulent, pus-like, nasal drainage 2, nasal obstruction or congestion 3, unilateral, one-sided facial or dental pain 4, facial fullness or pressure 5, cough sometimes. Prevention of sinusitis is based on the prevention of upper respiratory tract infections. All strategies, e.g. hand and respiratory hygiene, influenza, pneumococcal, and COVID-19 vaccines that help prevent upper respiratory tract infections could be useful in preventing sinusitis, including vaccination against Streptococcus pneumonia and Haemophilus influenzae type B for all children worldwide, 35-36. For countries considering vaccination programs for influenza, vaccination of high-risk groups could be considered, for example, children aged 6 months to 5 years. 7. Treatment of acute sinusitis treatment depend on disease severity, duration, and intensity of symptoms. We can use for treatment 1. Symptomatic treatment such as ibuprofen, 200 to 400 milligrams every 6 to 8 hours, max 204 grams per day. Paracetamol, acetaminophen, 500 milligrams every 4 to 6 hours, max 4 grams per day. These drugs, very effective antipyretic and analgesic medication. In some cases, such as fever, is larger than 39 or purulent discharge or facial pain, or patient with chronic underlying comorbid diseases. We should use antibiotic 2. Antibiotic treatment such as amoxicillin 1 gram every 8 hours, oral amoxicillin, in addition to clavulanic 500 milligrams plus 125 milligrams every 8 hours oral. In severe case, we use the antibiotic drug with antipyretic and analgesic saline solution in case of nasal irrigation for effective treatment.